For the last 10 years, in order to inhibit blood coagulation and reduce the risk of thrombosis or stroke, an increasing number of patients have regularly been taking medication such as direct oral anticoagulants, or DOACs. As costs for these medicines go down, just as population ages rise, use of DOACs are expected to see double-digit growth for several years. Normally, DOAC medication would be stopped before a surgery, as it increases the risk of bleeding. However, what happens when patients come into emergency and the doctors have no idea whether or not a patient is on a DOAC? If a patient arrives unconscious, in shock, or confused, with no family members present, how is an emergency doctor to know whether or not the patient is currently taking DOACs? It is essential for the doctor to identify the risk of bleeding induced by DOACs or to assess the cause, especially in cases of internal bleeding, open wounds, or treatment for thrombolysis. Until recently, the only way to detect DOACs was through specific laboratory tests, which take up to 45 minutes for results, if such tests are even available. This can critically delay a clinical decision. There are, of course, several coagulation point-of-care tests providing quick results, but an abundance of literature shows that such tests, like PT, APTT, or TT, do not provide clinically reliable results and are not qualitative. With DOASENSE, on the other hand, results are available after 10 minutes and are clinically demonstrated to be highly reliable. Not only can important clinical decisions be made faster, DOASENSE also provides a qualitative indication of the type of DOAC present when a test is positive. It is the first point-of-care test with CE regulatory approval, as well as approval with a growing number of non-European countries. The testing methodology is similar to well-known established urine tests, doesn't require a laboratory, and can be performed 24/7 with simple user training. DOASENSE offers saving from reduced lab costs and labor, as well as enables selective, targeted use of expensive antidotes. As DOACs are excreted by the kidneys into urine, they can be identified within 1 to 2 hours after oral intake. DOACs are prescribed daily or twice daily for chronic conditions, so the risk of a patient arriving in emergency having taken DOACs for the first time less than 2 hours ago is deemed to be low. There are two main categories of DOACs, those that inhibit thrombin and those that inhibit factor Xa. Common approved thrombin inhibitors are dabigatran or Pradaxa. Factor Xa inhibitors currently approved are more numerous and varied: rivaroxaban or Xarelto, apixaban or Eliquis, and edoxaban or Lixiana. The DOASENSE DOAC strip has two very distinct zones: the handling section, which is plain, and the parameter zone, containing 4 pads. From bottom up, these are creatinine, urine color, factor X inhibitor, thrombin inhibitor. The 2 control pads establish the validity of the test which is performed by the 2 testing pads. Let's look at 3 examples. In example 1, the strip shows a valid test with negative results. Both control pads are valid, and the testing pads didn't react to the presence of DOACs. In example 2, the strip also shows a valid test, but this time the test shows a positive result, revealing the presence of thrombin inhibitors. In example 3, the strip, also valid, shows a positive reaction to the presence of factor Xa inhibitors.